The members of the National WIC Association are extremely proud of the value and importance that WIC has played and continues to play in transforming the nutritional well-being of millions of our nation's at-risk women, infants, and children. Born out of an idea nearly 30 years ago, the National WIC Association was founded to provide leadership to the WIC community in promoting quality nutrition services, advocating for nutrition, health, and social services for all eligible women, infants, and children, and assuring sound and responsive management of what our members believed and continue to believe is the nation's premier public health nutrition program, the Special Supplemental Nutrition Program for Women, Infants, and Children, WIC. The National WIC Association has played a pivotal role in advancing WIC's successes in promoting healthy pregnancies, improving birth outcomes, and transforming the nutritional well-being of America's vulnerable mothers and young children to the nation's policymakers on Capitol Hill, to successive administrations, and to our many collaborating partners. We are grateful for the many public health, hunger, and faith-based and political leaders who helped to found this important nutritional program and have partnered with the National WIC Association to grow WIC into the successful program it is today. Few families in America are untouched by the success of WIC. The National WIC Association's members are honored to have the opportunity to positively affect so many lives in such life-changing ways, as together we help to give our nation's children a healthy start in life, transform their lifetime eating habits, giving them a foundation that gets them ready to learn. Everything that the National WIC Association's members do on the front lines of serving WIC mothers and young children in the 10,000 WIC clinics across our nation comes from their hearts with love and through a deep and abiding commitment to serving those most in need. Our motto, feed them well, love them lots. Your child has you and you have WIC. The National WIC Association is pleased to join with the Maryland State WIC program in presenting Saving the Children, the Story of WIC.
The Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC for short, has become such a basic part of our nation's nutritional safety net that many people can hardly imagine a time when the program did not exist. From a tiny program serving 88,000 participants in 1974, WIC now reaches more than 8 million people, including nearly half of America's infants and a quarter of the children aged 1 to 5.
WIC provides specific foods to provide nutrients that have been identified as missing and as essential for good health outcomes during pregnancy and infancy. And it was designed to address the major hunger and nutritional deficiencies that were observed in our country in the mid to late 60s.
The 1960s was a time of great ferment and unrest in America. A time when many believed societal wrongs could be righted and problems resolved. It was in this climate that civil rights and anti-poverty groups brought America face to face with a problem it had long been ignoring: the fact that many people, including many children, went to bed hungry. Hunger came into the national spotlight in the spring of 1967 when Marion Wright, a young attorney for the National Association for the Advancement of Colored People, led Senate Poverty Subcommittee members Robert F. Kennedy and Joe Clark on a tour of the Mississippi Delta. The visit uncovered unthinkable poverty and malnutrition. More investigations and reports followed. Then, in May 1968, came the explosive CBS documentary, Hunger in America, hosted by Charles Kuralt.
America is the richest country in the world, in fact, the richest country in history. We spend a colossal amount of money, $1.5 billion a year, to feed the rest of the world. But this spring, a private agency, the Citizens Board of Inquiry, consisting of distinguished leaders in many fields, released an exhaustive report claiming that serious hunger exists many places in the United States.
The documentary revealed that hunger's victims were often children.
Do you have any food in the house now?
No, sir, I haven't got anything.
What do you tell your children when they come home and there is no food?
That we haven't got anything to eat, and we just have to lay down like that until the next day, see if we can find something to eat.
And that's it?
Yes, sir.
If this was news to many Americans, it wasn't to doctors working in public health clinics. David Page, a young Johns Hopkins University pediatrician, had seen the effects of malnutrition firsthand in inner-city Baltimore clinics.
I saw a very high level of iron deficiency anemia, undergrowth, many of the infants showing poor weight and length indices. It was rather a prominent problem at that point in time. We found this to be a problem among the poor, basically. It really didn't make a difference whether one was African American, white, Hispanic. It was really a problem of poverty.
Dr. Page wasn't alone in his concerns. Medical researchers around the country were warning that poor nutrition could have devastating effects on children's minds and bodies.
There are some indications that iron-deficient children have poor attention span and perhaps learn less well. There are some animal studies which indicate that iron deficiency early in the growth of the animal can lead to long-standing changes in the brain.
But if the problem lay in poor nutrition, could it not be remedied by improving the infant's diet? That was the idea behind a small experimental program that Dr. Page launched in Baltimore in 1969, a program that was to become one of the models for WIC.
It struck me that it was a rather logical approach that we provide food as in the same way that we would provide medication. If we used medication to treat pneumonia or other diseases, we could use food in a therapeutic sense to begin to ameliorate a range of nutrition-based health issues.
Page approached the Maryland Food Committee, a nonprofit organization that worked on hunger issues, seeking a modest grant to test his idea.
Dr. Page presented what he wanted to do and what he hoped to accomplish, which would be better nutrition for their babies and better school readiness for the children as they grew. And I felt that he was worth supporting in this particular project.
Page sought to offer iron-fortified infant formula to high-risk, low-income mothers at a clinic in Baltimore's Cherry Hill neighborhood. After tracking the infants for about a year, Page began to see striking improvements in the children's health.
We began to see a marked reduction in the level of growth stunting as well as iron deficiency anemia, and we were quite excited by that.
Anxious to see if he could achieve similar results with a larger study population, Page began to work with the Maryland Food Committee and state and local health departments to expand the program to other areas in Baltimore and across the state. The group received a federal grant to help with the effort, which they named the Iron Fortified Infant Formula Program. Mothers had been picking up the canned formula at clinics, but as the program grew, Page and the committee realized they needed a more efficient distribution system.
We came up with a system that really approximated a traveler's check so that we could provide to the mother in the clinic a voucher. She could sign it and then countersign it when she redeemed it at the store.
At the same time that the Maryland infant feeding program was expanding, pressure was mounting at the federal level to find a way to address the problem of malnourished women and children across the U.S. In 1968, the Department of Health, Education, and Welfare had convened a series of meetings to seek ways to address the hunger-related illnesses doctors were seeing in local public health clinics. Among those invited to attend was Rodney Leonard, who oversaw food assistance and safety programs within the U.S. Department of Agriculture.
Essentially what they needed was to be able to prescribe food for the clients who were not ill and needed a drug. They needed food. So in order to meet that request, we developed a system of commissaries that the Department of Agriculture stocked. It was a USDA budget that was used to provide a service that HEW could not provide out of their own budget stream. And so we built the commissaries in the local clinic. We stocked them with food that the doctors said that a mother and an infant would need, including infant formula.
Lack of administration support kept the commissary program from reaching large numbers of people. But after Leonard left the USDA to found the nonprofit Community Nutrition Institute, he began to brainstorm a more far-reaching effort with Jim Thornton, an aide to Senator Hubert H. Humphrey. The two men came up with an idea for a new federal pilot program that would become the Special Supplemental Food Program for Women, Infants, and Children. In designing their program, the men drew on the Johns Hopkins model, as well as an infant feeding program at St. Jude Children's Research Hospital in Memphis, Tennessee. WIC would provide vouchers for nutritious foods to women, infants, and children who were considered at nutritional risk. The program, which was to last for just 2 years, was also to include a scientific evaluation of the impact of the improved diet on the health of mothers and their children. Although the $20 million a year initiative was modest by federal standards, Thornton and Leonard anticipated resistance from the Republican Nixon administration, which had been impounding funds for social programs enacted by the Democratic Congress.
We had every reason to believe that the incumbent administration would oppose it, would not support appropriations for it, so we had to figure out a way around it.
Thornton and Leonard wrote language into the WIC legislation that required the administration to implement the program.
The word shall was used everywhere in the law. There was no permissiveness. The Secretary, the President had no choice. If the Congress passed this, they were under obligation, legal obligation, to carry out the Congress's wishes.
And instead of funding the program through the normal appropriations process, they tapped a little-known pot of Agriculture Department money to provide a guaranteed funding stream. But perhaps the greatest coup was to enlist Minnesota Senator Hubert H. Humphrey as the chief sponsor to usher the legislation through the Senate.
He was a man of great influence and great power at that point in the United States Senate. And when we went to him with this program, I can assure you it took no convincing whatsoever. Once Mr. Leonard and I laid out the problem and laid out what we suggested by way of a program, he said, let's do it, and let's do it now.
Although the conservative Senate Agriculture Committee refused to report out the WIC measure, Humphrey used his clout to take his amendment directly to the Senate floor. There, Thornton had mounted a dramatic display of photos from St. Jude Hospital showing malnourished children.
And as the debate went on about the bill, Humphrey would take 1 or 2 senators at a time and explain to them, here's a picture. This is what we're trying to deal with this program.
You'd think he was a combination pediatrician, nutrition, physician, all combined up there. He was waxing and waning, and he was being listened to, believe me. And of course, it was passed in a very nice, substantial vote.
With the backing of influential Kentucky Congressman Carl Perkins, the House concurred, and the bill was signed into law in September 1972. But then, 9 months passed while the U.S. Department of Agriculture took no action to implement the program.
It was a difficult program for agriculture. They knew how to do stuff with price supports, they knew how to do stuff with the international shipments of grain, they knew how to do stuff with research, but they had never run a food program through public health before, and many of them just didn't want to do it.
So it took at least a couple of years to actually get off the ground. While the Department of Agriculture tried to give it to the Department of Health, Education, and Welfare, tried to whittle it down to a small research project to see if food assistance could change the health status of children, and finally was pressured into beginning the program itself.
To push the agency to implement the program, WIC advocates enlisted Ron Pollock, founder of the Food Research and Action Center, a public interest law firm known as FRAC for short. A few years earlier, as a young civil rights worker, Pollock had witnessed a scene in a Mississippi shack that had fueled his resolve to fight hunger.
Cupboard was bare. The icebox didn't have any food in it. And I saw a young kid with a distended belly. He had all these flies all around him, and he had no energy to swat them away. He had sores all over his body. And I remember leaving the shack and saying, "This is the United States of America. How could this be?"
Pollock was convinced that the WIC program could help prevent situations like this one by filling a gap in the federal nutritional aid effort.
The school lunch program was clearly intended for children in school, so it was for older children. Other programs which started in the early 70s, summer feeding program, the child care feeding program, school breakfast program, they also were focused more heavily on older children. And so WIC actually had a niche in terms of serving the very youngest children for whom, if they were hungry, it would cause irreparable damage.
Frack filed suit in federal district court and won a series of victories that forced the agency to begin implementing the program, and the WIC budget ballooned.
So what was originally a $20 million per year program to operate only over 2 years ultimately became a $250 million program, because the remedies we kept on getting in our court proceedings was to spend the amount of money over a shorter period of time, so that the annualized rate of expenditure just skyrocketed.
The first WIC clinic opened in Pineville, Kentucky in January 1974. Before long, several hundred clinics were in operation across the country, thanks to advocacy organizations, which alerted agencies to the existence of the program and helped them apply.
Initially, the Department of Agriculture was not putting together the material that local entities that could apply would need in order to know what the program was about and how to go about applying for it. So advocates put together application packets and then distributed those application packets across the country.
In the meantime, a series of high-profile hearings in the Senate Select Committee on Nutrition and Human Needs, chaired by Senator George McGovern, was setting the stage for the creation of a much larger, permanent WIC program by focusing attention on the toll malnutrition was taking on the nation's children.
We had discovered that low-income, pregnant, and nursing mothers were vulnerable, that at a time when they needed to have a good nutritional balance in their food intakes, many of them were not experiencing adequate, well-balanced diets. And we discovered that children of low-income families were in many cases especially vulnerable to malnutrition.
Among the experts who appeared before the committee was Dr. David Page, who presented the results of the Johns Hopkins infant formula feeding program.
I felt as though I had a mission, and my mission was to present this information, do it as well as I possibly could, because people depended on me, because this was important for a lot of children, a lot of infants and a lot of families, and they were quite interested, quite receptive, very warm.
So we had a distinguished doctor from one of the world's great universities tell us that what we were proposing was not only possible, but valuable.
With positive results beginning to roll in from the pilot WIC sites, Alan Stone, an aide to Senator McGovern, was tapped to draft legislation to establish a permanent WIC program. As Stone was crafting the bill, he faced his share of skeptics.
You know, when I was first writing this bill, people said to me, you know, public health centers are never going to do this. They don't want to hand out vouchers for food. This isn't what they do. And I said, no, the strength of this is going to be that it is through the health system. It's food and health. And this is the direction the country's going in.
The bill, sponsored by Senator McGovern and Representative Perkins, had strong bipartisan support. It was passed by Congress and signed into law in 1975. The WIC program was to be administered by the U.S. Department of Agriculture's Food and Nutrition Service, but carried out by the states through a network of clinics and agencies at the local level. There, healthcare workers performed health assessments to determine the nutritional risks and needs of participants. Mothers received WIC vouchers, which could be redeemed at grocery stores for foods like cereal, fruit juice, eggs, milk, and infant formula that were high in protein, calcium, iron, and certain vitamins. An important feature of the program was its requirement that mothers receive nutrition education.
You can't just hand out food and think that it's going into the people that it is intended for, and that it becomes a habit, and that they learn to use those foods as part of a well-rounded diet.
By getting people into clinic settings, WIC also indirectly helped participants address their healthcare needs.
WIC benefits does not include health care per se, but because the program is administered by local health agencies, families were then going to health departments or community-based clinics. So in many instances, when families came to WIC agencies, they were enrolled in Medicaid, they learned about immunizations, and there was this wonderful opportunity to provide other services to families, some of whom had never had much to do with community health clinics or local health departments.
While the WIC program was generally well received, one thing that did arouse controversy was its heavy reliance on infant formula.
The use of infant formula got increasingly controversial as time went on because there were advocacy groups and breastfeeding supporters who felt that if you were giving formula free, it was a disincentive to breastfeed. So the use of formula was criticized, but was very important because the breastfeeding rate was extremely low.
Over time, as the benefits of breastfeeding became better known, the WIC program stepped up its efforts to encourage mothers to breastfeed.
WIC has, for a long time, provided breastfeeding promotion, encouraging our participants to breastfeed. However, we've gone beyond that now, and we are establishing very strong breastfeeding education and peer counseling that will support the breastfeeding mother.
Today, WIC is viewed as one of the most effective preventive health programs in the nation's history.
We have data that shows that WIC significantly improves pregnancy outcomes. It significantly improves birth outcomes. It significantly improves the quality of health for the infant.
WIC also saves money in the long run.
In other words, the children who are properly nourished and well-fed do better in school. They aren't in the emergency rooms with this illness or that as often as others.
If you can make a healthy baby and a healthy mother, you've not only helped their lives immeasurably, you've helped society immeasurably by bringing in healthy citizens.
A large part of the program's success can be traced to the unusual dedication of the WIC staff.
The best public policy and the greatest number of federal resources won't make any difference to any family unless there is dedicated staff locally. And it's the caring and willingness on the part of local staff that you hear time and time again is one of the reasons the program's as successful.
I've had a number of people who say, I like coming to WIC because they care about me. That's been the true success of WIC. The people in WIC truly care.
More than 30 years after its creation, the program continues to enjoy strong bipartisan support, and many people cannot imagine what life was like before WIC.
it has meant a lot to what is now a whole generation of mothers now raising their own infants, and WIC is still there. So from being a very iffy sort of program at the beginning, it has become a basic part of health care, and it is wonderful to see that.
It's one of the best pieces of legislation that Congress has ever passed and has helped millions of young mothers, has helped tens of millions of infants and children.